One of the upshots I've walked away from in the last few months with regard to the literature that's coming out is that everybody is beginning to understand that antibiotics, as wonderful as they have been and can be, are not the answer to everything. Or, as I say, they're not mother's milk. They're not a harmless treatment. And I treat patients all the time in my practice who have the damaging results of long-term antibiotic use. I'm not saying haphazard. Maybe they were needed, but sometimes haphazard. Sometimes because a doctor doesn't have a better solution, he'll give a patient antibiotics just to see what happens and see if it improves their condition. Some people have really serious infections and they need antibiotics. No matter what the reason is, when antibiotics have been used for a long period of time, there's lots of problems with fungal overgrowth, energy production at the level of the mitochondria, because antibiotics affect the mitochondria. That's the energy part of the cell. That's the engine of the cell. And it makes their intestinal tract goofy. We're going to talk about the intestinal tract in a little bit more depth, but basically your body has trillions of cells, but you get 10 times that many foreign bacterial, viral, fungal cells in your body. They're your riders, or the ones that ride along with you to create what we call the superorganism. When you take antibiotics, you give that thing a gigantic jolt, a huge shock. So we need to know that antibiotics are not a good solution all the time. Specifically, this article from the British Medical Journal talks about kids with infections. Man, that makes me nervous. A little kid who can't breathe well or they're really struggling, give them an antibiotic, right? Well, they're saying you probably don't need to. And the upshot of that is, I don't know about your specific situation, because your kid, maybe they need an antibiotic, or some of your grandkid maybe needs an antibiotic. That's fine. Your doctor can determine that. If there's an acute infection, they'll know. But antibiotics aren't the solution that everyone had hoped they would be all the time. We want to go very easy with antibiotics. And specifically in this case, this was about croup and maybe an infection that lasted maybe 2 or 3, 4, 5, 6, 7 days, like a longer infection. And they're concerned. And you can see with kids, it makes you nervous. But what you want to do, if a child is going to take antibiotics and your doctor has looked at them and it really makes sense, always add back probiotics. So add back the good bacteria. So you don't have to be frightened. If your doctor says you need antibiotics, don't buck them. Don't say, no, I'm not going to do it. Consider what he's saying. Maybe get a second opinion if you're real uncomfortable, but always use probiotics. 15 billion to 30 billion units of a good probiotic with lactobacillus, acidophilus, and bifidobacter. You get those two in to follow an antibiotic regimen, and you can undo a lot of the damage that antibiotics cause before it creates any other problems. Always, if your kid's sick, get with your doctor. We're better together.